UnControlled Substance with your host, Dr. Cozzette Lyons-Jones, Chief of Adult Medicine for the Watts Healthcare Corporation.
UnControlled Substance.
Welcome to UnControlled Substance with Dr. Cozzette and my love, Mr. Noel Jones.
What up, what up?
Hey, this is episode 18. Can you believe it? We're in December.
I know.
2021 is almost done.
Wow.
Son,
good riddance.
Good riddance
to
indeed.
2020, good riddance to 2021.
Yeah, there were some good things in 2021, but so much heartache as well. So I get it. I get it. This episode, we're going to make a connection between the current pandemic that we're dealing with and lessons learned from the epidemic of HIV/AIDS. And there's a lot of commonalities and a lot of things that shows us that we haven't learned our lesson and how we handle this current situation that we're in. So I'm excited because we have my friend and fellow Association of Black Women Physicians sister.
That's right.
Dr. Anna Lopes Johnson, that we will welcome into the examination room later in the show. But she's a phenomenal woman and is on the front lines of this pandemic currently, and also on the front lines in terms of educating the communities of color regarding PrEP, pre-exposure prophylaxis that's available for persons who may consider themselves to be at higher risk for contracting HIV/AIDS, or who just want to take that extra layer of precaution, right? So it'd be great to have that conversation with her later. We chose this topic because we're in the month of December, and December is World AIDS Day on December 1st.
That's right.
And so it's a time where the red ribbons come out and we take a look back on the journey that has been traveled in HIV/AIDS. The World AIDS Day itself was first started 40 years ago, believe it or not, after the CDC officially reported the first cases. On June 5th, 1981, there was a curious report that appeared in the CDC's weekly Public Health Digest of 5 young gay men across the Los Angeles area that had been diagnosed with this unusual lung infection called PCP pneumonia, or pneumocystis carinii pneumonia. And so this was very well known for me at the time. I was in training, back then. And so we saw a lot of these cases. HIV looks so different now compared to when I was coming through the ranks as a little young doc. But thank God, we've overcome a lot of things, but we have a long way to go to get to the nirvana that we want, which is cure, right?
That's right.
Or
and
complete protection.
I've seen your journey dealing with HIV and your heart toward those afflicted with the disease. You've done everything from World AIDS Day productions, bringing the quilt to LA long time ago. That was the early, early 2000s? Yeah, 2000. Yeah, so I know this topic, this disease, and fighting this disease is near and dear to your heart. It's been great watching it.
It's funny you bring that up. I wasn't even thinking about my own personal journey when I just, felt the topic was deserving of a conversation. But my journey actually started in HIV. I thought that I would specialize in it.
Right.
I worked at the Care Clinic in Long Beach. And that was under an NIH grant that unfortunately I was not able to continue under that grant. And that's how my career kind of changed. And, I ended up in academic medicine for a while and other things. But for me, that and the World AIDS Day programs in South Central in particular, in the faith-based community, to be able to talk about conversations that were stigmatized, especially at that time still, and still is today to a certain extent. But I think we're having more conversations now than back then, but it was pretty intense. So you had to kind of sneak and get people to come to these events with, celebrities and, shout out to people like the late Daryl Coley.
Yep.
Daryl Coley, man, gospel great, as well as B. Slade.
B. Slade,
artist formerly known as Tone.
was
these were people
early on,
before it became in fashion to do those types of things. So shout out to B. Slade. For me, to get people in there to get tested was the goal.
Yeah.
And to get the education. And so this is full circle. So looking at 40 years since the first cases were identified, it was the first time that AIDS was reported in the U.S. 40 years ago. And days after the initial report hit the news, the CDC learned of many more cases. And as we know, it exponentially increased from there as far as the numbers. But there's a difference between what happened in terms of the activism around HIV/AIDS and what's happening now with marginalized communities, vulnerable communities, again being disproportionately impacted by disease. And I bring this up also because the agenda of current President Biden is in alignment with the topic for today and with the needs for our community as a whole. He said he's asked Congress to provide $670 million to fight new HIV cases by increasing treatment, expanding the use of PrEP or pre-exposure prophylaxis, and ensuring equitable access to treatment. He wanted to make sure that everyone in the United States knew their status or knows their status, their HIV status, and everyone with HIV receives high quality care and treatment that they deserve, right? And that we end this harmful stigma around HIV and AIDS. The goals outlined in his strategy include preventing new HIV infections, improving health outcomes for people with HIV, reducing health inequity, and establishing a more coordinated effort to address the epidemic. The strategy identifies a number of priority populations, including Black women, trans women, people between the ages of 13 to 24, and people who inject drugs, as well as Black, Latino, and African Indian / Alaska Native men. So it's in alignment with a lot of things, with the health justice, health equity messaging that's going on right now, and dismantling systems and structures that are in place. He's even calling for going after the criminalization of HIV, the laws that criminalizes.
I got you.
And, that's controversial. There's people on both sides of the aisle on that one. But at the end of the day, at least someone is aggressively shining light on it in a high space. So kudos to him.
That's right. This is what our federal and even state government should do. Set big goals and go after them. We're going to the moon. Let's get going. We're going to end AIDS. Let's do it. But that's what our governments are for, setting the big goals that we as individuals can't do, and then throwing the resources at it, throwing the brains at it, and let's get it done.
Yes. So with that, I wanted to kind of give a little primer on HIV/AIDS to kind of, get our listeners up to speed on where we are, where we've been, as well as where we are, and how we got here. The early years of AIDS epidemic were very uncertain and unsettling. The LGBTQ communities were losing friends and loved ones to this disease, one after the other. They didn't have an idea of what was going on, what this thing was, why it was happening. And it seemed like society as a whole turned an eye to it, they a blind eye to it. They didn't really acknowledge it as a societal problem, So that's another theme that we're seeing that's consistent, even to this day with the current pandemic, with COVID, how we categorize people as far as, what's going on. So the perception of AIDS was viewed as a gay plague, a condition thought to be tied to the lifestyles and behaviors of gay men.
That's right.
Even though cases were also being reported for women and infants and people with certain blood disorders like hemophilia and those who injected drugs. Politicians and government entities were pretty slow to act, and activists took the matters in their own hands. Among those efforts was a pamphlet that came out around 1982. It was called How to Have Sex in an Epidemic, One Approach. And we laugh about that now, but when you think about it at the time, it was not a common practice to wear a condom if you were a gay man having sex with a man, right?
Gotcha.
And so to put a message out there, letting them know about the risk and maybe even reconsidering having sex, like stop having sex with some of the messages, or stop having as much sex, or put a condom on if you're going to have sex. Those were the areas of messaging. That's major. Telling 20 and 30-something-year-olds in the prime of their lives and energy, physically and all that, hormones raging, that they can't go and get busy, right? It's much more extreme or severe to me than telling people to put a mask on. I don't know about you.
I got you. Strong correlation, but you're absolutely right. You're absolutely right.
Yeah. So they had a greater hurdle to me to overcome in terms of, but the difference is the messaging was more accepted, by that community.
I got you.
Then there's more resistance to the public health messaging now, and a lot of it is because of the disinformation and misinformation that's out there, right?
That's right.
And also because of there were so much unknowns for HIV/AIDS, just like with the coronavirus, right? Many unknowns. So we were learning as we go. We're still learning. Now we got Omicron, and who knows what else is coming down the pipe as far as the variants for coronavirus. And the same thing could be said about HIV/AIDS, where we didn't know what was happening. They didn't have treatment. So when you look at the timeline of what was happening in the early 80s, it was considered a death sentence to have HIV.
That's right.
Right? Scientists and physicians were struggling to understand what caused the disease and how it spread. The tide turned when you got to the late 80s and 90s, and more effective therapies became available and transformed what it meant for an individual to live with HIV. Fast forward to AZT being discovered in 1987, and then you had activists pushing for the FDA to issue new regulations around clinical drug trials, making it possible for patients to access experimental, potentially life-saving therapies without having to wait years for official agency approval. So put a tack in there or pause on that, and just think about the fact that a lot of people are giving pushback on taking this vaccine because they think it came out too fast.
I got you.
But a lot of the science and a lot of the regulations and guidances were developed years before we got to this pandemic. So just keep in mind, the correlation. We owe a lot to the experience that we have with HIV/AIDS.
That's right.
In this current pandemic. We wouldn't have the current vaccine without the technology. They were using, the technology we're using now was intended for HIV. It never came to fruition, but it helped us in terms of the coronavirus vaccine. So I want to, pause there so we can pay the bills and take a station break on Uncontrolled Substance with Dr. Cozzette and Mr. Jones. We'll come back and continue the conversation momentarily on the Real Urban Radio Network.
The Real Urban Radio Network is streaming live on the World Wide Web at www.realurbanradio.com. Log on for the best old school and today's R&B. Can't get to a computer? No problem. Download our app from your smartphone app store. Just search for the Real Urban Radio Network.
Here we go.
Downloading. Bam. Just like that. You can take us everywhere you go. Also follow us on Twitter and Instagram by searching for us at Real Urban Radio 1 and Facebook by searching for the Real Urban Radio Network. We keep it real 24/7 on the Real Urban Radio Network. We're supporting black businesses and black lives always matter.
Uncontrolled Substance.
Welcome back to Uncontrolled Substance with Dr. Cozzette and my love, Mr. Noel Jones. We were on the timeline of HIV/AIDS, and I wanted to finish that before we go into the waiting room. We know how it is in the waiting room, right? So before we get there, let's think about it. So we talked about AZT was approved by the FDA in 1987. And then there was another important change that I mentioned in terms of the FDA issuing the new regulations around clinical drug trials. Remember, it was so taboo that it was a big deal when Magic Johnson, made the announcement about being positive back in '91. And I went and looked at some old footage and interviews at old Magic Johnson. Boy, was he fine when he was younger. He looks okay now. Nothing against you, man. You've aged gracefully, but boy. But I can understand what happened, how he got himself in that situation. But I feel like, wow, the things that he went through, you know, having to even retire at the prime of his career. So that was interesting to go back and look at. But it put a face on the disease other than gay men.
Yes,
you know,
it did.
it was a straight man that, you know, was black. So you had a lot of demographics that were hit there outside of the gay community, right? In 96, the FDA approved the first protease inhibitors, and so you have this HAART, what we call it, the highly active antiretroviral therapies, and that changed the game and changed HIV from being a fatal disease to a controllable condition. By 2010, we have what we're going to talk about with our guest today.
That's right.
We have PrEP came into the picture. There was a study that found that taking a daily dose of HIV drugs reduced the risk of infection for men who had sex with other men. In 2012, the FDA approved the use of PrEP for adults at high risk of infection, and that is a milestone, a huge milestone for HIV/AIDS epidemic. So I wanted to kind of go through those things so that you can see where we've come from and where we are currently. It's sobering. I love medicine. I love science, and it makes me appreciate the hard work of people who you may never know their names.
That's right.
You know, behind the scenes that make it possible for so many to live longer lives and to be with their family and their people.
Yeah, and as a another correlation with COVID, you know, God put us on this earth and told us we were stewards and rulers of this earth. And this is a conversation I've had with you. And how do we rule this earth? The physical, the natural, we rule through science. And he gave us that. Mm-hmm. So science has gotten us to this point with HIV/AIDS. Hopefully Biden and his initiative will get us over the hump to eliminate it. Like smallpox was eliminated, like polio has been knocked down, like measles have been knocked down. Hepatitis C, so many things. Hopefully people will understand that as it relates to COVID and get over the politics and everything else and use what God gave us. We're looking for miracles, and that vaccine might be the miracle that you were looking for.
Yeah. One of the things that I want to make a statement about on the air is that this disease, you know, has, you know, as I said, hit marginalized communities, right? It's been, you know, disproportionately affecting Black and brown communities.
Yes.
And people in poverty, the homeless, people with housing insecurity issues. I want to remind people that it's not about categories. I mean, you know, we talk about risk in terms of conduct.
I got
right?
you. I got you.
And we make it punitive if a person chooses not to get the vaccine. Mm-hmm. And although I can't wrap my mind around the person who can rationalize out of getting the vaccine with all the data and the information that's available to us now, that's my scientific mind. That's even my faith mind, I guess, to a certain extent, but it's more my science mind.
Fair enough.
It's concerning the posture of people who have chosen not to take that vaccine. But this is unfortunate as we see more severe cases and deaths among the unvaccinated at this point. But at the end of the day, when someone is sick, they need care.
That's right.
Not to be blamed.
That's right.
So I need for us to hear that message.
That's a good message.
You know, because it's the same thing that happened in HIV/AIDS.
HIV/AIDS, yes.
Which is the reason why I brought that up.
Yes.
Yeah. But let's go into the waiting room where people are mad because their doctor's late. Again, right? As always. So in the waiting room, what do we have? What's going on?
Well, the New York Times came out yesterday, and they had a number of items, and the bullet points were such that Biden tested negative 5 days after being exposed. I didn't even know that. to an official who had tested positive.
And we're going to talk about that a little bit more in a few moments when I touch on testing and how to keep ourselves safe during the holidays.
Yeah, very important topic. Oh, it's right upon us. Another thing was that Omicron infections do not seem as severe, and we had been hearing that from overseas. I guess more data is coming to that, but leading less often to hospitalization, and that was a report out of the UK.
Keep in mind that people are vaccinated, though, so it's less severe because you have a little layer of protection on you with the vaccine.
That's right.
Whereas people who are unvaccinated are still at risk for having more severe cases, hospitalizations, and even death.
It seems like it's a little milder for those two, though. So maybe it's more contagious by a long shot.
Definitely.
How close is it getting to measles? Have you heard anything? Not even close there, yeah. But yeah, it's not as bad. Another fact was that new cases are slowing in South Africa, which suggests that its Omicron wave may have peaked. And that's, they look at that. Epidemiologists look at the rise and fall of these in other countries, see how it's going to happen here. So hopefully that's good for here. The
importance of that is the fact that we had a travel ban on people coming from South Africa and Southern African countries.
That's right.
And Biden is now considering lifting that ban because the original intent was we were not sure if Omicron had made it to the U.S. yet. We're trying to, see what was going on, before we allow travelers from those areas to come in. But it's here. So
it's been here.
Yeah. So he's considering lifting that ban.
Also, the FDA cleared Pfizer's COVID pill for high-risk patients age 12 and older.
Yeah, but people, they're going to be scary about it. It's their babies. But I'll tell you this, we got our son vaccinated.
We did.
Yes, we did. And he's
got his first shot.
11 years old. He took it like a champ.
Yeah, he did.
Had a little soreness in the arm, and that was it.
Wanted to hug on you.
Yeah, well, yeah, that was the only thing. But that was a benefit.
That was great.
I loved that part. He wanted to hug me a lot that night, but he was good. He was good.
Also, Britain surpassed 100,000 new cases, and England reduces COVID isolation periods to ease staffing shortages. I hear they're talking about doing certain things like that here as well in the schools in terms of isolation periods. I know the NBA did it as well, and the NFL did that also. And finally, Omicron is motivating Americans to get boosters, but not bringing more initial vaccinations, a poll found.
So I'm a reader of Wall Street Journal. I love it. They had an article out about the kits. And I always wondered about that because I was reading about in Europe how they had easy access. They were getting testing kits, delivered to their homes, regular people. They could go to the local store and pick up a kit. So access to testing seemed to be more robust abroad compared to here. So it was interesting when I came across this article. The Omicron variant accounts for about 73% of infections for the week ending December 8th. Preparing for an anticipated surge in overburdened medical system, the White House directed sending 1,000 military medical personnel to hospitals in January and February. FEMA was directed to do assessments of hospital needs and to support expanding hospital bed capacity. PPE, the mask and gowns, and ventilators are being positioned so that they can be quickly sent to states that need them. New federal testing sites are being opened throughout the country, starting in New York City this week. Free at-home kits will be distributed to Americans beginning in January through a new website. Now, I need to find out that website and post it on our pages and things because information is power.
Yep.
It's available, but if you don't know how to obtain it, that's another issue. So the White House will continue to use the Defense Production Act to ensure we are producing enough kits to match the demand. And recall back in January, the White House announced the insurance companies would reimburse people for at-home test kit purchases. So keep that in mind. Remember, all test kits aren't the same.
Okay.
And are only as good as the user's technique and the timing of testing. Fast-acting, at-home rapid tests are less sensitive than the lab-based PCR tests, but are quick. You can get the information quickly. And it lets you know about the level of infectiousness of an individual if it comes back positive.
Gotcha.
In contrast, the PCR test lets you know it takes longer. The turnaround is longer, a day or two. But it lets you know the extent of contagiousness of an individual. So they give you different information. The White House is also deploying emergency medical response teams to 6 states: Michigan, Indiana, Wisconsin, Arizona, New Hampshire, and Vermont. Biden was doing a lot there. White House has been criticized, though, by the public health officials regarding testing shortage, the lagging behind European countries, including the UK, where people have been able to get the free packs of rapid tests from the government for months, or to get them even cheaper than here. In his defense, we need to acknowledge the unexpected rapid spread of Omicron virus. I'm always going to, look at both sides of it. Yeah, whatever.
Yeah, I'm a critic.
Yeah, but critique this. Former President Trump took the booster shot.
Yeah?
What message does that send to his supporters?
Do what I do and not what I say. I hope that's the message.
No, that's not the message. It's not. But I found that interesting. It's one point in which he and Biden are of one accord, right? Yeah. In terms of schools, there's a new philosophy and message that's out there right now. And you'll like this. I want to say this for you, Mr. Jones.
Okay.
The Biden administration endorsed a testing strategy for K through 12 students designed to keep children in the classroom even after exposure, shifting away from the previous mandatory quarantine guidance. It's a new philosophy that we believe the American people need to hear and come to grips with, which is to focus on how to live with the virus.
We need to know how to live with the virus. We need to begin understanding that we are going to have to live with this virus. I'm tired of the short-sighted politicians before. I hope this is a sea change in how they deal with this. They're late. The messaging has been terrible. But now I think people are getting their minds around the idea that we are all going to get this thing. There was an article in The Atlantic, among many articles, that basically the title was, "Don't be surprised when you get Omicron." Just flat out. This thing is going to be with us. If you've ever gotten the common cold, you're going to get Omicron because it's just going to be around. So hopefully it's the mortality and morbidity goes down with this as variants come out. But don't be surprised when you get it. Prepare to get it. We don't want to get it fast. We don't want everybody getting it at once.
Right.
So use your mask, get vaccinated, do everything we're supposed to do. But don't be surprised if you get it. So what does that mean? That means we have to live life in a way that allows us to go forward and at the same time keep people safe.
I hear you. I'm thinking about my little girl as they shut down these colleges and ship these kids home and have them going remote again with their finals, and it's questionable when they can return and all that. It's a lot going on. So we want to take a station break and come back with our guest, Dr. Anna Lopes Johnson, on Uncontrolled Substance with Dr. Cozzette and Mr. Noel Jones on the Real Urban Radio Network. Stay tuned.
Uncontrolled Substance.
Join me, Apostle Everett Wright,
every first Sunday of the month at 1 o'clock p.m. Pacific Standard Time for Rhema Fest. This show is all about receiving a right now word from our Lord and Savior Jesus Christ for our community, family, and even our great nation that will give us hope and strength in these last and trying days. Again, that's Rhema Fest with me, Apostle Edward Wright, every first Sunday of each month at 1 o'clock p.m. Pacific Standard on the Real Urban Radio Network app and realurbanradio.com.
Uncontrolled Substance.
Welcome back to Uncontrolled Substance with Dr. Cozzette on the Real Urban Radio Network. And we are so excited about having my friend, Superwoman, I call her Super Mom, Super Mommy Doc, Dr. Anna Sophia Lopes. Dr. Anna Sophia Lopes is a board-certified family physician who has spent much of her career advocating for underserved medical communities. She currently has been working in the urgent care providing medical care to COVID-19 patients. Over a career spanning nearly 2 decades, Dr. Lopes has practiced family medicine and primary care, and most recently in urgent care. A native of New England, Dr. Lopes' educational journey began at Boston University, where she earned her Bachelor of Arts in Mathematics. After her undergraduate studies, her next stop was Tufts University School of Medicine to prepare her for the road ahead. In her formative years, Anna had witnessed personally the inequities in medical care that existed for communities of color. This motivated her pursuit of medicine generally and her intent to work with underserved communities specifically. Toward this end, she targeted and trained in family medicine at the University of Miami Jackson Memorial Hospital Residency Program. Put a pin in it. You know, they accepted me for residency. You and I almost were almost in residency training together. It's crazy. Right. I didn't know that. At Jackson Memorial, Dr. Lopes would develop a multicultural perspective in medical practices. Her passion for serving and building up underserved communities only grew while she completed mission trips to Haiti, Panama, Belize, and Brazil during her Fogarty International Fellowship. During that time, she served as the chief resident in her residency program. Later, she gave back to the National Health Service Corps scholarship by serving at one of Jackson Memorial's satellite health centers in the Haitian and Cuban communities of southern Florida. Her career would go on to demonstrate her unwavering commitment towards positive change in the lives of underserved patients and the medical institutions that they serve. We can go on and on about this woman, but our intersection came through the Association of Black Women Physicians. And Anna is a past president of the organization and currently is providing mentorship to medical students and volunteers as a community service advocate and educator. So welcome to the show, my love.
Thank you so much for having me, Dr. Cozzette. I'm excited to be here.
Oh, so happy. And the reason so that people will know you're the perfect one to have on the show today because you're on the front lines of the pandemic, so you know the pains that come with managing people who are, infected with COVID-19. But you also are an advocate, an educator in the sphere of HIV PrEP. And so the two have a lot in common as we discuss throughout the show. And we're going to continue the conversation through this discussion in the examination room. So let's jump into it, okay?
Great.
All righty. So let's start with just talking about the rate of new HIV cases declining since the COVID pandemic. Should we look at this and say it's because fewer people are having sex and those who are taking greater precautions, or is there something else going on?
Well, I heard someone say this so eloquently. They said, if you didn't buy a puppy, an air fryer, or have a baby in 2020, you weren't in a pandemic, right? So most of us, I bought the air fryer. Okay. But people were definitely having sex in 2020, right? We were home alone. We were in shelter. And it was because of the fear of contracting COVID and the risk of the unknown that caused a lot of people not to go in for testing. Also, a lot of testing sites closed down, and a lot of visits were virtual, right? But to test for HIV, you actually need to go into a laboratory or a screening facility to do that.
Right.
So a lot of those were closed. So that's why that's part of the reason why we believe that. The numbers dropped. But I think we had spoke about this, but you mentioned that 13% of people with HIV in the U.S. don't know their status.
Right.
45% of the youth aged 13 to 24 don't know their status. And even in other data, we see that there is a drop-off between patient understanding and education, physician engagement, and testing. So testing is definitely where it all starts. So I think the issue was testing and not necessarily that our incidence or prevalence has decreased.
Understood. So what is PrEP? Let's get to some basic information. And who should consider asking for the prescription?
That's a great question. PrEP is a medicine for people who are at risk for HIV. Now, if you are not sure if you're at risk, before we get into labels and probably the next segment, remember, if you are a person, man, woman, pregnant woman, transgender, man, woman, anyone who is having sex with one partner and they're not sure of their status, or if you're having sex with multiple partners, or if you're injecting drugs or any high-risk sexual behavior, then you are a candidate for PrEP. PrEP is a once-a-day daily pill that helps reduce the transmission of HIV. Currently, it's our most effective preventive tool that we have to combat HIV.
So why are people resistant to taking PrEP?
Ooh, that's a layered question. I think a lot of it is, it has to do with the stigma around HIV. So HIV, early in the pandemic in the 80s, just a brief history, we saw HIV as a gay man's disease, and it was originally called gay-related immunodeficiency disease. And later we realized that it was affecting the immune system of cisgender heterosexual women as well. So we expanded the definition and got rid of that label. So a lot of it has to do with people don't like labels and they don't want to be associated with anything that is different from the heteronormative stereotype that we have in society. That's part of the reason why people are not on PrEP. Another reason is that physicians are also not bringing it up in the exam room, and we're not having conversations about a sexual history or even having a discussion about PrEP candidacy. So that's also on us, on the healthcare system, to do better.
So as a woman, I'm always going to, look for ways to improve the health of my women, my sisters. Public health and medical providers struggle presenting PrEP as an option to women. Why is it important for women to be aware of this prevention option?
56% of the new HIV cases are in men. They are in men who have sex with men. So if you are a woman and you are having receptive vaginal intercourse, you need to be aware that you are also at risk for HIV. And that's because your partner is at risk for HIV if you're not sure of their status. So that's what we're trying to do, is just to normalize the conversations about healthy sexual relationships, who people love, who people have sex with, how people have sex, and to get away from the stigma that this is just for a certain type of individual, a certain type of gay male, or a certain type of promiscuous person. Black women are having sex with men who may be having sex with other men. And so for them, we want them to have this tool to protect them, along with condoms to prevent sexually transmitted infections.
That's a point well taken. I'm thinking about the current movement that's happening in medicine and in public health as far as health equity, racial equity, and I'm thinking about the different structural and patient level and provider level things that could be barriers to getting care and prevention for black men who have sex with men. What are some examples of barriers that you know of or have thought about addressing when you go and speak in different venues?
Yeah. Well, you know, Dr. Cozzette, doing the work that you do, and I've heard you on the air talking about the many social, economic, and structural barriers that continue to prevent some people, particularly people of color, from accessing the care they need. One, there could be job insecurities. Most people receive their health insurance through an employer-based job. Right. So if you're not employed or gainfully employed, then you might not have access. You might be going through a public health department to access your care. Economically, that also ties into how much money you have, how much do these drugs cost, and they are affordable, and there is assistance available if you deem you're a PrEP candidate. And then socially, just black men in general and the intersection with racism and how we in our healthcare system, we currently deny that racism is still a problem, and we have not fully embraced that. And so until we do that and really take it under control, and every physician has some level of cultural competency in treating black patients and taking a sexual history, we're not going to get there. So we need a full revamp of our healthcare system and really look at these social determinants of health, economic determinants, structural barriers, and racism to really address the problem that we're seeing in the HIV pandemic.
And the political determinants as well. I totally
agree.
Absolutely.
Absolutely.
Now, I'm thinking about the culturally competent, the need for cultural competence and getting the messages out and educating the community. When I think about media and commercials, most of the commercials for, say, Truvada, Descovy or whatever, in PrEP, they have been skewed towards presenting gay men, whether it's gay men of color or not, right?
Right.
In those commercials. Do you think that we need to address that in terms of the messaging in those commercials in order to change the face of the need to get this information out to the communities that are not gay?
Oh, yes, absolutely. People have a hard time with labels, right? I have a hard time with labels. The term that's currently being used is MSM. Right. Now, look, the commercials are created by the pharmaceutical companies to do exactly what they're doing. So they're increasing awareness and education, and they're driving sales. This is a capitalist healthcare system. People want to have more of a public health approach and a holistic approach to our healthcare system, but unfortunately we have not achieved that, and that's our reality in the United States. Our job as the physicians is to provide that complete care, that holistic care, and treat the entire individual. I do think the commercials are biased or geared towards the transgender, the MSM population, and that's rightfully so, because they are the largest percentage of new cases in HIV. And right now, what we're doing from a strategy prevention is not working, because they still have higher rates than the average individuals. They only make up 6% of the population, but they're 48% of the new HIV cases. So the commercials are doing exactly what they're doing, which is driving sales, increasing awareness, and they're driven by the pharmaceutical companies. Now, for people of color who don't identify as gay or bisexual, we really need to work as a physician in the exam room and through education. And I just want to give a shout out to the Association of Black Women Physicians, who put together several public service announcements doing just that, presenting HIV and PrEP education to communities of color for people who are cisgender and may not identify with gay, bisexual, transgender labels.
Exactly. Great work, and congratulations to you on being able to lead that effort on behalf of the Association of Black Women Physicians, along with our president-elect, Dr. Renee M. Poole.
Thank you.
Wanted to close out this segment before I take you into the checkout, and just ask you, you know that President Biden put out this, call for ending HIV, right? By 2030. It's a lofty goal, right?
Right.
And PrEP is an important tool, in the president's plan to end HIV. Do you think we'll reach, that goal by 2030?
So right now we're seeing about 40,000 new cases annually of HIV, and he wants to get it down to 3,000 cases annually, and we're just not there yet. I do want to commend the Biden-Harris administration for, thinking of new HIV/AIDS strategies where we are incorporating the latest data on HIV trends. We're looking at incidence and prevalence in real time. We really need to do a deep dive into the social determinants of health that impact someone's risk and outcome for HIV. And I think having Vice President Harris on the ticket helped include a piece on advocating for laws to reform the laws that criminalize HIV. I think that was her contribution, her presence did, I think, lend to that piece into the strategy plan. And then there's going to be collaboration with the private sector, right? So there's $2.2 billion in funding to support the Ryan White HIV/AIDS programming, which people know provides primary medical care. What we're missing, though, is that piece, that positive messaging and that focus on stigma reduction and STD prevention focused on Black men, particularly men who have sex with men. We still need robust HIV programming to talk about education, housing, jobs, and wellness, the things you mentioned, the social determinants of health. And we really need concentrated support for our men of color, Black men. And we haven't even talked about the incarcerated individuals yet. Right. We don't even have a plan to address them. We're not even testing them. And we know the prevalence of HIV is higher in incarcerated individuals. So we really need to consider universal screening upon entry into the jails and prisons and link them to care with PrEP, educate them about PrEP, and provide the medication before their release, and have them follow up after release. So there's a lot we can do. I think it's a first step, but the plan needs to be more robust.
Thank you, Anna. So we're going to take a brief station break here and come back into the checkout. I like to keep you on air, though, and you go into the checkout with me as we give some pointers, both from the HIV PrEP topic, as well as some pointers for keeping safe during this COVID pandemic and holiday season, Christmas, New Year's, leading into MLK.
Yes.
Alrighty, sweetie. We'll be back. Good. We'll be back on Uncontrolled Substance on the Real Urban Radio Network. Stay tuned. Thank you.
From Los Angeles to the Mason-Dixon line, tune in for today's R&B and your favorite old school on the Real Urban Radio Network.
Welcome back to Uncontrolled Substance with Dr. Cozzette. And we're going into the checkout now. And Anna has been a wealth of information. We've only scratched the surface on this topic. We'll need to bring you back again in the new year, sweetie. But I wanted to, give some information. Helping patients pay is a huge thing. We need to get that information now so people won't think that it's cost prohibitive and that they don't get access to PrEP and even getting tested. I like the strategy. What do they call it? And I meant to ask you about it. Were you familiar with it? Because I found it to be very a wise approach for people to do a status neutral approach to testing.
Right.
And I'm not sure if you're familiar with that at all. Have you heard that term before?
Yes. So that what you're referring to is it's a model. It's a service delivery model on how to deliver care to patients who may be at risk for HIV. So it's a cycle, right? So regardless of their HIV status, you want to keep them engaged. You want to continually talk to them about testing and test appropriately. You also want to give them information about PrEP, regardless of who starts the conversation.
Right.
It could be the physician, provider, or the patient. And you just continually assess if they're at risk for HIV exposure. If they tend to be, if they progress and they become HIV positive, then the model allows them to continually stay in the model and retain in HIV care, get them on treatment as soon as possible, work on suppressing their viral load as a physician with heart therapy. So that's what the model is supposed to do. And the endpoint, it's not a final state. It's constant, continual. It's a dynamic process where both parties are engaged, the patient and the service provider or the physician.
Excellent. Now, I want to, put out there that most insurance plans and state Medicaid programs cover PrEP. Prior authorizations may be needed in some cases. There's a Ready, Set, PrEP program available for people who don't have insurance. You can call 855-447-8410 or go to www.getyourprep.com to get more information about that if you're uninsured. A copay assistance program is also available through Gilead at www.gileadadvancingaccess.com, and then you can look at your state programs locally for more information. This should not be a barrier to accessing this much needed tool in our kit for combating and fighting this disease. So I, wanted to put that. Did you have any comment or last words that you want to say in terms of HIV PrEP? Before I give some comments and kind of pivot back to the pandemic as we close out?
I think the message that I just want to convey is that sexual expression and sex is part of the human experience. And until we normalize that and start discussing a thorough sexual history, we're not going to be able to overcome the stigma. So that's really what the take home is really to change the narrative around sexual health.
Absolutely. I'm so concerned because I know in the South the numbers are really high.
Oh,
in fact,
goodness, yes.
Yeah, and our black men, in the South, it's so much so that the Biden campaign under the strategy for lowering the rates by 2030 is targeting 7 states, 6 of which are in the South. And I'm like, wow.
Right, but it also it mirrors the disparities that we see in terms of economics, housing, food insecurities, all the things that we know affect health.
That's right in line with why we have this show. So that was perfect, Anna. So I wanted to pivot back to give some sage advice, some words of wisdom as we continue through this holiday season. We're going through Christmas. We just passed Christmas, actually, and we're going through New Year's and entering into, MLK holiday in January. These are all opportunities for gathering and socializing, people coming together and enjoying your families. The vaccine being on board makes it look a little different than it looked last year, right? When it was just quiet. No one went anywhere, absolutely at all. Although there was still a lot of traffic. There was still a lot of flying. Let's be real. But
LA.
Yeah. But to help our listeners, we wanted to review some of the guidance on how to gather more safely this holiday. Of course, the question is, when should I get tested? How do I do this? Testing should be done if you're symptomatic. Of course, that's a no-brainer, right?
Right.
It should be done if you're exposed. You have a known exposure, whether it's at work or in your community, right?
Right.
There's different tests that are out there, so the test you get is important, in terms of the question that you're asking. So rapid tests have a high rate of false positives early. So if you are having symptoms and you get a negative test and continue to have symptoms, you should retest in 3 to 5 days if you go for the rapid test. If you don't have symptoms after exposure, wait 3 to 5 days, then get your first test. Because you don't want to get it too early when the viral load is low, right? You want the levels to get to detectable. So you should keep working, though, because a lot of people think they could go home automatically. But if you have the vaccine on board, no, you're not going home. And you're asymptomatic, you're going to keep working. Keep working, folks.
Right.
Test before gatherings and parties and travel, especially for indoor maskless events. Consider who else will be present. Your family and friends who may be elderly, immunocompromised, have high-risk conditions. You have to keep them in mind. It's not just about you, it's about your community, right? So try to test as close to the start of the event as possible. The ideal scenario is to test at the door before entering the party, right?
Oh, that would be perfect. Yeah, that's a great, like the antigen test that people have been coming in for. We've been hit so hard. Just think of that as lasting a few hours. Like if you have an event that's a few hours, that's a great test to do prior to the event, as you mentioned.
Right. So, and we'll get there with the test kits going out, and to consumers' hands. I think we'll get there, hopefully, at some point. Avoid exposure after being swabbed. So you don't want to get tested and think that's your get-out-of-jail-free card, and just be...
That's right. That's true. Your test is good for that day. That's right.
It'd be willy-nilly.
A lot of people think it gives them a pass for the month.
Yes, exactly. So I just wanted to put that out there. The CDC recommends testing 1 to 3 days before travel, and again after travel if you're unvaccinated. And everyone should get tested if they have symptoms. So I wanted to put that out there. The unvaccinated are looking at a winter of severe illness and death. And that's straight out of our president's mouth, right? And it's true.
Right.
And it's true. The vaccinated people if they adhere to the recommended precautions, they should be able to gather throughout the holidays without as much anxiety. But you don't want to let your guard down. You want to add anything to that? I think I hit the highlights.
Yeah, that's well said. And I just make a plug for the booster. If you haven't boosted, and it's been over 6 months since your last vaccine, think about getting your booster. Continue to practice what we learned in 2020. Yeah. Keep washing your hands, sanitize, and stay 6 feet apart from people you don't know when possible. Right. But you've hit all the other key points.
And I have family coming in, because we did our Christmas by ourselves. We had no one last year. But this year, we have people coming in. My dad is coming in, and sister-in-law, her kids. And I have tables we're setting up in the yard and heating lamps. Everyone is vaccinated and boosted. And for the couple of kids who are not, they're getting tested today as we speak. So, so these are the things that will make it so that we can sit in the room without our mask, even if because we're a family, small, and so a couple of households.
I think that's safe. I think that's safe if you keep your gatherings small. There's going to be new data coming out regarding possibly changing the quarantining guidelines for patients with COVID who are vaccinated. We're not there yet, but I anticipate that will come out sooner. Once you have the antibodies with the vaccine, it helps neutralize the COVID. So the thought process is that you're not as infectious, or there's less COVID circulating, and you might be able to release your quarantine sooner. So that is something positive. And data and studies and our lived experiences do show us that people who are vaccinated do have milder illness than
Right.
those who are not.
Right.
So that's just another reason to get vaccinated.
Absolutely. Well, Anna, this has been wonderful. I just, I adore you as an individual, but
I
also
just
as a
loved
doctor.
what you guys are doing, and this is such a wonderful platform. Congratulations on all your success, Dr. Cozzette, and give my regards to your husband. This was fabulous. Hopefully we were able to affect a few of your listeners, and hopefully they can start the conversation about PrEP.
Absolutely. So thank you so much. Again, this, is our last one. I can't believe it. Our final episode for 2021. We started when the pandemic hit, actually, last year. And, I'm looking in the mirror going, Lord, really? Radio show in the midst of a pandemic. Okay. But, it's worked out.
I love it.
And it's been a blessing. We've learned so much. And it allows me to showcase my super friends, because everyone who's been on here they just are spectacular in their fields, and they've brought so much to the table in terms of being able to move the needle and educate population that may not listen to this kind of conversation in other, on other stations. So it's an opportunity to be able to just serve in a different way. And so this has been an awesome experience. I'm sorry my husband can't give the closeout on this one because he had to rush to go and get his dental work done. So he couldn't close out at the end, but he also, wants to put out there, a massive thank you to our listeners, our viewership. It's surprising to hear and learn that so many people are actually listening to the show. You don't know who's out there because you're just in this room, in the studio, and you all call in for the interviews to keep it COVID safe. It'd be great when this lets up and we can allow people to actually come to the studio and we all be together during the interview.
Oh, that's going to be an amazing experience.
Yeah. But we look forward to bringing more good content and conversation in 2022. I say blessings to everyone that are listening on today. Thank you for your support. Go to our page. We have pages on Instagram as well as on Facebook. And also download the app for the Real Urban Radio Network to have a even greater or more enhanced listening experience. We are on every fourth Sunday of the month at 1 p.m. Pacific Standard Time. We appreciate you and thank you and say happy holidays and see you in the new year.
Oh, happy holidays. Thank you so much.
Thank
Bye-bye.
you. Bye.